is the New Orleans Musicians Clinic. I can personally testify that the New Orleans Musicians Clinic saved my brother's life. He had a heart attack on stage at Jazz Fest, and Musicians Clinic was right there with him, getting the ambulance, bringing him to the hospital, paying for his doctors in the hospital, and he's alive today because of the Musicians Clinic. Our next speaker is Megan McStradick from the New Orleans Musicians Clinic, and I guess she can explain to you how all this is going to relate to the New Orleans Musicians Clinic. Would you come up, Megan?
I'm Megan from the New Orleans Musicians Clinic, and I'm pretty glad because a lot of the points I was going to cover was kind of just discussed right here and now. You people that come to the Musicians Clinic here, I'm just going to go on over some points, how it's going to affect the Musicians Clinic and all. The way that we're funded is through NOCI, which is Greater New Orleans Community Health Connection, and the levels to qualify for that, it's the same thing as the free care. So it's 200% below the poverty guidelines right now, which is less than $22,000 for one individual. So actually, NOCI is a Medicaid expanded program, and it has been expanded for 2014. However, the income guidelines are going to go down to 133%. So it's kind of just important for people to know this because they have one more year before they're kind of getting a lot of anxiety about like shopping in the marketplace. Apply for the marketplace exchange and you're eligible for Medicaid, you will be bounced to Medicaid. But the main thing is just making sure your coverage is still active and you know where your income level lies basically, and that's a big problem for musicians I've seen because a lot of musicians don't file their taxes, and also if one of the spouses work, sometimes people file separately and everything, and it can make a huge difference in the coverage that you're eligible for. Basically, I'm going to become a navigator at the clinic, and if anyone needs assistance, there's obviously a lot of questions that are unanswered, and I've been attending as many meetings as possible, and one of the things I would suggest is just getting involved as well. I know that WWOZ has held the workshops every Saturday from 3 to 5 at different locations, and they have people from the different insurance companies coming to like guest speak. That way you can speak with someone directly from an insurance company that is offering these exchanges. So as far as I'm aware, there are 5 that are going to be offering this, like you said, so that could always change. It's changing all the time. I have a marketplace application checklist of all the things that you're going to need if you need this. That Actors Fund booklet is extremely helpful.
Materials that you need to apply. Is this what you're talking about, prepare to apply list?
Yes,
It has
correct.
social security numbers, etc. For a musician, can you expand on this part that says pay stubs, W-2 forms, and wage and tax statements? Because personally, I don't get a whole lot of W-2 forms and things like that. So what might I need to have aside from a copy of my tax return?
Now, I would also encourage people to start looking into resources that you can go to for free that will help you with your taxes during tax season. I know that TCA has a free workshops, and they also have free tax people that you can go to and make an appointment with. And this can even be if you don't get paycheck stubs or any 1099s, you can create a calendar of how much you work and how much you make, and you can bring all of that paperwork to them, and they can kind of work out with you so that you can file your taxes. And then the IRS has a list, and they do it at UNO and Delgado. So that's just something to look forward into, look into in the future. And I know a lot of the young patients that have been coming to the clinic. I just kind of want to make sure they're aware of that, because we do have some patients that are over the age of 65 that come to the clinic, and they haven't been eligible for any of their Social Security benefits or any of the Medicare benefits. So they're still going to University Hospital to register for the free care, and they're still basically working like they are 20 because they're not receiving any of those benefits that they could have ever paid into because they were off the record for that long.
Yep.
So I just want to make sure that people are aware that those services are available, and it does take time, but it will definitely be worth it in the end.
For those of us who have been filing every year, wouldn't it be just easier to bring your most recent tax return, like my 2012?
Yeah, that one. And that's just one of the other things. We don't know exactly how, we don't know if you're going to have that tangible piece of evidence that you filed your taxes, or we don't know if you're just going to plug the numbers in, or how you prove that you filed taxes. We don't know exactly what that is, and I guess I'll know on October 1st, or maybe I should have asked.
Great, thank you, Megan. Then here, what are the benefits of getting a health insurance plan? This is what you prepare, okay? And then it says if you become ill or injured when outside of New Orleans, your medical care will be covered all over the USA.
Correct.
Is that for emergency services only?
That's for all preventative, every piece of your healthcare. So we do have a lot of musicians. So we have a lot of musicians that come to the clinic, and a lot of them travel. So they've always had the Greater New Orleans Community Health Connection or the free care. But if they can get this Affordable Care Act for paying that amount, it would severely benefit them. Because we get a lot of calls from people that are in New York, all around, that were on tour, that they had to go to the hospital and everything, and this would just greatly benefit those traveling musicians.
If I was on tour in New York and got bronchitis, I could go to the clinic and not have to pay an arm and a leg to get medication.
So you would have to pay the same amount that you would have to pay if you were going to any provider in New Orleans.
But that's in the States only, that's not Canada?
Also, I just wanted to let you know, I did print out a slideshow. Like, they have a lot of really good resources, and then another good resource is cms.gov. So they have different slideshows from presentations all around Louisiana. They also have direct links to people that work within the health insurance companies that can offer you more. Because it's ultimately, even though health insurance companies have some sort of issue with this, it's ultimately probably going to end up being like a competition. So they're going to want to offer the best plans for individuals. So they do have some representatives on the websites that you can get access to. And somebody from WWOZ after October 1st are trying to work on like a health fair, maybe at the art market on Frenchman Street, where we can get representatives out there to have like brochures and just exact numbers of, that you can compare. Because I know right now it's kind of difficult because you don't have an exact number, and someone can say $30. But $30, for someone that never had to pay that expense before, can kind of be a lot, and you're going to have to take that into consideration. You have another question?
Yes, does the whole application process have to occur exclusively online?
You can do it online. You can do it paper or online.
Okay, so how would you get the hard copy?
So there's it's going to be available to print out actually on the same exact website where you would apply online.
Okay.
I tried to print it out, but it just sounded out.
So that hard copy stuff could be sent through the mail?
Mm-hmm. Yep.
Okay.
Musicians Clinic is the best thing that ever happened to our musicians in New Orleans. I really want to thank Megan for coming out and